Once again, there is continued talks of Ontario government-imposed shutdowns due to the constant pushing of the case-demic, which, as my colleague Andrew says in this report, cases don't necessarily reflect actual infected individuals. No, as you can see, cases also include probable and presumptive cases. And just how many? Well, that doesn't matter. All that matters is ensuring it is not business as usual in Ontario, under the guise of safety, of course. For Rebel News, I'm Tamara Ugolini, and I find it concerning that Premier Ford is once again restricting business not only in Toronto, Peel, and Ottawa, but as we know now, York Region as well. This comes with heavy criticism on Ford, especially after the WHO strongly recommended against lockdowns. Ford's press announcements continually note his hardships and feelings of misfortune, but like so many pandemic decision makers, his salary has been unaffected by lockdowns or pandemic hysteria. It's the businesses, not him and his steady salary, bearing the actual weight of bankruptcy and lost revenue. StatsCan reported that across Canada, business closures doubled at the height of the pandemic. The report goes on to say, in April, Canada recorded 88,187 business closures, which is twice the 39,078 that shut down in the same month last year. This report also showed fewer new businesses are opening. So while people's livelihoods were and continue to be delayed in the name of safety, get this, at peak pandemic, at the local hospital here at Northumberland Hills, the ER was so empty that hospital staff had time to collaborate and coordinate an entire music video. Look at this completely empty ER here, and here, and here. And yes, that goes on for 12 minutes of a heavily edited, poorly choreographed, collaborated, and coordinated music video. It confirms what this CTV News article says on April 29th, that all of our rooms are empty. The ERs are vacant during the pandemic. It continues on that there have been 30 to 40% drop in patients in many ERs across Canada. And they actually urged people to come in with a different type of YouTube video than the one we saw at the Northumberland Hills Hospital, where this ER doctor reassures people that their hospital is safe and available to patients.
We're here for you, and no one will ever be denied care.
This Globe and Mail article headlines that Ontario hospitals were scrambling to open more beds as they brace for the surge in coronavirus cases. And it goes on to show that just one hospital, the Kingston Health Sciences Centre, cleared nearly half of its 444 beds by cancelling elective surgeries and moving patients to a hotel. Dr. Samantha Hill, president of the Ontario Medical Association, in this article states under the emergency orders enacted by the Conservative government, all but essential health care was paused and doctors began holding appointments remotely. And data from the Ministry of Health shows that 52% of all physician visits were taking place by phone or video. So when I stumbled across this info bulletin on the Government of Ontario's Ministry of Health and Long-Term Care website, I was pretty surprised. Issued on April 22nd, 2020, when we knew so little about the virus and we're on, I think, was week 5 of 2 weeks to flatten the curve. Apparently, the claims service branch knew that physicians would need a COVID-19 advance payment program. The Ministry of Health apparently recognizes that physicians are essential partners in the fight against COVID-19 and is committed to working with physicians who have been affected by the outbreak, including those who were unable to deliver their regular types of services during this time. The COVID-19 Advance Program will provide monthly interest-free, automated advanced payments that will be set off against future OHIP payments to individual physicians. Payments assessed under the previous 12 months were examined, and a monthly average was determined based on payments for that period. The program will automatically top up physicians' payments to 70% of this average. Physicians who were eligible for advance payments will automatically receive these payments in May, June, and July of 2020. So the update to this bulletin found here under the recovery of advance payments shows that, for instance, one independent physician will have received $9,202 in May, $10,752 in June, and $10,310 in July, for a grand total of $30,264 over a 3-month period. And they get to pay back that amount over the course of 6 months, interest-free, which works out in this particular example to be $5,044 a month. Not only did Ford force the closure of everything that he deemed non-essential, he also shut down routine healthcare. Doctors could no longer physically see patients because of the dreaded surge, which never actually happened. And let's be honest here, many of these doctors wanted to see patients in person, do their diagnostics, and call their office staff back to work, just like every other business owner in the country. But they too were paid to stay home like the medical CERB. And now Ford government estimates place the backlog, which is partly due to the COVID impact on hospital capacity, at 148,000 procedures. And despite the term elective, these are comprised mostly of medically necessary surgeries like cancer and cataract removals. Here in Ontario, if you're a physician, it's okay. The government will give you interest-free loans and a reduced back pay schedule to ensure your practice survives. But small and medium-sized businesses, well, they may qualify for a subsidy and need to prove it, but they also face increasing restrictions, and even if they abide by all of the rules and bankrupt themselves trying to keep up with costs, well, we may just shut them down again because health and safety. So Ontario, open for business, but the government gets to decide who is and who isn't. For Rebel News, I'm Tamara Ugolini. If you want to help us help others against these tyrannical measures and government-imposed restrictions, head on over to fightthefines.com. That's fightthefines.com.